My name is Lorraine Jelagat. I am a pharmacy student at the University of Nairobi. I stand here as the country manager, the country representative of PIT Africa. First of all, I'd like to thank the organizers of this conference for giving us the opportunity to come and share what we have. I'm not alone. I have my team from the PIT Africa Kenya office. If they would kindly stand and wave, I think it would be nice if I acknowledge them. So kindly, ladies. I work with. There's one person in absentia, a gentleman. He was not able to be with us today. So I've only been given a few minutes to share what I have. Okay, so PIT Africa. PIT Africa is a relatively new organization. It's a tech company that was originally founded in Nigeria way back in 2019. Founded by pharmacy students and graduates who saw the need of adopting technology into the healthcare sectors to solve problems which would otherwise be difficult to solve without technology. The main aim of PIT Africa is to bridge the gap between healthcare providers, professionals, and students and technology. Our goal is to enable them become problem solvers using tech in their work, education, and improve healthcare services in Africa. What problems are we solving? As I've told you before, we want to bridge the gap between healthcare professionals and technology. As you may realize, in our various courses and everything, we are given the skills which we take out there and contribute towards the healthcare field. But what if the problems that we see in our healthcare sector can be solved using technologies? Seeing that we might decide let's hire a software engineer or maybe a computer scientist, right? So that they can develop various programs and apps to help us solve the problem. But I'm sure you know the saying that goes, the wearer of the shoe knows where the shoe pinches. We are the ones in the healthcare field, right? And we know where the problems are. What if we ourselves were the ones to develop a solution to that problem? At PIT Africa, that's what we aim to do. We aim to empower medical professionals, students, and anyone in the healthcare field who aims to solve this problem using technology. Okay, PIT Africa. PIT Africa is an entity divided into three. We have the PIT Africa itself, TechMed Institute, and the PIT Innovation Lab. PIT Africa comprises of the member communities from various countries. As I've told you, it was originally from Nigeria, but towards the mid this year, they were able to expand to various countries in West Africa and even to East Africa, because we have the PIT Kenya office right here in Kenya, and also the PIT Tanzania office. The TechMed Institute is an edtech platform which provides medical professionals with essential tech skills and educates them on the relevance of technology in healthcare. The TechMed Institute was formerly the PIT Academy, but due to the restructuring, they changed the name to the TechMed Institute. Okay, I've just realized I've not told you what PIT Africa stands for in full. Back then, when it was formed, it was named Pharmacists in Tech Africa because it was originally formed by pharmacists. But as time went on, they realized that if we decide to stick to this name, we would only be attracting pharmacists. But pharmacists are only part of the larger healthcare sector, right? We have medical doctors, nurses, everyone else. So they are trying to incorporate everyone. Next, I've discussed about the PIT Africa itself, the TechMed Institute, and the PIT Innovations Lab. Say you have a solution, right? You have a problem, and you have a solution to that problem, right? But you might not know where to start, right? So the PIT Innovation Lab gives you resources and also a hub of medical professionals who can help you solve that problem with the help of technology. Now, PIT Africa, apart from what I've said before, the TechMed Institute, the PIT Innovation Lab, PIT Africa organizes events with the help of various student organizations and schools, and various student organizations and schools to organize events such as the Tech Jam, which includes activities like hackathons, panel discussions, and presentations by industry experts. The hackathons provide a platform for participants to showcase their innovative tech solutions. The speakers and panelists are experts in various fields who share their knowledge and insights during the events. Although we've not been able to host a hackathon yet, because as I've said before, the PIT Kenya office was only set up a few months ago, I think in August. But in the future, we are looking forward to growing to that place. Now, apart from that, we also have a program called the Health to Tech series, where we bring together healthcare professionals who are currently incorporating technology into their current practice. In fact, the series has been running for about 2 months now, and we have one scheduled for this month, which will be on the 26th of this month, where we'll have a veterinarian who is also a cybersecurity expert talking about the ethics of healthcare tech, balancing innovation with safety. Balancing innovation with patient safety and privacy. Do you see the concept of One Health being incorporated there? Yeah, so that's something that we're looking forward to. Now, it's obvious that we as the youth, we were born in the digital age, right? In fact, I think the term that they use is digital natives. We exist at a time when technology and the internet has been consistently growing and progressing, and so we are more conversant with technology more than someone who was born before the digital age, right? So we have the skills. We have the skills to solve problems using technology. The power is in our hands, as we have the mind, and the power is also in our hands, in our phones, in our minds. So PIT Africa aims to bridge the gap, to bring together technology and the healthcare field. And I think I've come to the end of my presentation. I was given such a short time, but I want us to play a game.